Good afternoon, everyone. I'm Emily Reamer. We're taking you live now to Pittsfield, where Governor Baker has just met with officials there about the coronavirus cases in Berkshire County. Talking with local leaders there, local health leaders. You can see the lieutenant governor is also there on the governor's right-hand side. We're hoping to learn more about what he has learned about these cases.
Mayor Tyre and the members of the delegation, as well as the folks from the Public Health Department who are here today. We just had a long conversation about preparedness and planning here in Berkshire County around the coronavirus for the city of Pittsfield and the rest of the region. The number of reported cases, as everybody knows, has seen a significant uptick in the United States and in Massachusetts. And state health officials are closely monitoring and tracing presumptive positive cases. And this concludes the 7 cases people know about that are here in Berkshire County. The DPH is currently monitoring a small number of cases of community transmission of unknown origin in Berkshire County, and state officials are working closely with the impacted hospital as well as the local officials to monitor this situation and keep the community safe. I think, as everybody knows, there's 95 cases of coronavirus in Massachusetts now. The outbreak and the impact of concerns over the spread are already being felt by everyone. It may seem hard to grasp the changes that have occurred over the past couple of days. This includes the travel restrictions with respect to Europe, the suspension of professional sports games, and the closures and cancellations of schools and many other activities. Certainly significant change in the daily life for virtually everyone, and to say there's disappointment and discomfort would be an understatement. But at this time, it's pivotal for all of us to understand why many of these steps are so important to be done now. The data indicates that the number of people infected and requiring medical attention is very much within our healthcare system's capacity. And the purpose of moving forward with many of these measures now is to act before the numbers increase to a point where the virus spread really does begin to severely impact the Commonwealth. The highly contagious nature of this disease means if everyone plays their part in slowing the spread down, the number of people who become infected and require medical attention does not spike all at once, overwhelming all of our systems. And we understand that asking people to change their habits, cancel events, cancel travel, change the way they work is inconvenient, and we understand it also comes with a financial impact. But waiting to act and allowing infections and the subsequent number of people who need medical attention to spike all at once will not only severely hamper our hospital's ability to care for patients, but will have a far greater economic impact in the future as well. The federal government continues to issue new rules and guidance related to travel restrictions and social distancing. We encourage the public to remain informed and follow their guidance, either on the CDC website or on the DPH site here in Massachusetts, and we'll continue to enforce the recommendations at the state level. Earlier this week, I think most people know that we declared a state of emergency in Massachusetts. That declaration gives our administration more flexibility to respond to this outbreak. The administration has enhanced guidance for executive branch employees, and we continue to encourage employers and organizations to follow that guidance where it's appropriate. We've also limited visitor access to long-term care facilities. This was something we talked earlier with the delegation about, and to keep some of our most vulnerable residents safe. We've also encouraged older adults and individuals with health issues to avoid large events and gatherings. We're seeing an uptick in presumptive positive cases, in part as a result of increased testing, and we expect as testing continues to increase that more cases will be reported in the near future. Our lab recently received enough materials to conduct an additional 5,000 kit tests. Thankfully, the Mass DPH is more advanced than it is in many other states, and that enables the lab to now process 4 times as many samples as it was processing a week ago. But we need much more testing capability, and we need the federal government to help us get there. What that means is we've been asking the federal government to support more places, both private labs and hospital labs, to run these tests, and we need the FDA and the CDC to act on these requests. This is a serious disease, especially for older residents and for those with pre-existing conditions like respiratory disease, lung disease, and heart disease. And as we've said before, for the vast majority of people who contract this disease, it is not deadly. And the latest research shows that children and young people are at an especially low risk of health complications. But we must step up our mitigation efforts to avoid large numbers of people requiring medical care around the same time. That way, our healthcare facilities can continue to provide the care that they are currently providing to others. China and other countries that saw early outbreaks are making progress in pushing back against the disease, but it's only possible if everybody plays their part, and it's only possible if we step up our mitigation efforts now. For individuals, that means what you've been hearing from us for several weeks, which is to wash your hands for at least 20 seconds with warm water constantly and use hand sanitizer. To cover your mouth with your sleeve if you sneeze or cough. Stay home if you're not feeling well. I can't express this one enough. There have been plenty of anecdotal incidents that have occurred over the past several weeks in which people continued when they didn't feel well to go outside, to go to work, to engage, and to be part of the community. That's simply just a bad idea. And people need to continue to stay informed on guidance as this issue evolves from the healthcare officials in your community and from the Commonwealth. And obviously, we urge everybody to do their part and stay informed. We had a terrific conversation. I want to turn the podium over to the mayor, and obviously we'll be available for questions after that.
Thank you, Governor Baker. We feel here in Pittsfield very supported by Governor Baker and Lieutenant Governor Polito. We also are grateful to the Massachusetts Department of Public Health for being responsive to our concerns and for very quickly providing Pittsfield and Berkshire County with 2 epidemiologists to help us understand the dynamics here in Pittsfield and in the Berkshires. We are very concerned about our families, and we understand that they are very worried about what's ahead. This is an extremely fluid situation, and as the mayor of the city of Pittsfield, I want to assure our residents that we are well prepared to respond quickly to evolving circumstances. Earlier today, we did issue an emergency declaration which allows us to quickly access state and federal resources. We have issued a number of recommendations to our employees and to our community in terms of how to contain the spread of COVID-19. Our goals are twofold. We want to mitigate and protect public health, but we also want to maintain essential services for as long as possible. So we've put some plans in place, and we've worked really hard to develop those plans. And so now we're prepared to work those plans while also being nimble enough to respond quickly and efficiently as the situation evolves. Again, it has been, as always, a great privilege to have this conversation. We feel very much supported. Our Director of Public Health, Gina Armstrong, came with a list of requests, and they are not only
the delegation, Mayor.
Yes, that's right. And they are not only specific to Pittsfield, but to Berkshire County, because here in Berkshire County, we have a strong network and a strong collaborative spirit here, and we care deeply about all of our residents. So thank you very much for coming to the Berkshires again and supporting us in this time of great need. Thank you.
Questions for us or for the mayor or the delegation?
Governor, you said there an additional 5,000 tests.
No, enough testing capacity to test 5,000 people. A kit is not one person, okay? So we got enough to do 5,000 more people.
So where does that bring, I mean, where were you before and where, we know where you are now, you can test up to 5,000, but
We got capacity to test 5,000 more people. We had capacity, that's 5,000 additional. We had capacity to test several thousand before that.
like less than 5?
Less than 5,
Or
5,000 is not the total, okay? 5,000 is additional on top of the several thousand we got before.
Do we have enough?
We certainly believe that we have what I would describe as an adequate supply today. But as I said in my remarks, we need the federal government, the CDC and the FDA in particular, to give hospitals and testing facilities here in Massachusetts that have the capacity to test the material and then the approval that they need to actually begin to test themselves. The fact that the state lab is the single source of testing at this point in time is not adequate. And we have hospitals in eastern Massachusetts, central Massachusetts, western Massachusetts. We have labs not related to hospitals, independent, privately operated labs, all of which have the capacity to do this if they can get several requirements and authorizations from the feds. We've talked to the delegation, we've talked to the administration. I know that the providers themselves have also talked to the delegation and to the administration, but this is among our highest priorities in terms of things we're looking for out of the federal government right now. I think there are probably a lot of people all over the country who are engaged in similar kinds of conversations.
Do you know
But
how
this
many
is a
labs-
critical issue for us.
How many labs have applied and what it could potentially bring the capacity to?
I don't know how many. I can tell you that it's a pretty significant number.
Governor Warren as to who is actually getting tested, because we're hearing from hospitals saying that we don't have enough to test all the patients who are coming in. And then the Celtics just came out and said that they're going to be testing all of their players in the next few days. So there seems to be some pressure on that.
Well, as I said, we need more testing capacity in Massachusetts, and our primary objective over the course of the next few days is to get the feds to give the hospitals and the private labs the material they need to actually prove that they can do this and then get authorized by the FDA so that we can significantly enhance our testing capacity. Well, remember, people are running tests based on CDC guidelines with respect to who should get tests. And that's the way we've been operating since the beginning. There's been an ongoing conversation between the Department of Public Health, the Department of Elementary and Secondary Education, and many of the school superintendents and mayors and other city councils, city managers, sort of local officials generally. And I expect that we'll have more guidance available for people on that tomorrow. I think the most important thing we need to do is make sure that we provide local communities with the best guidance that the DPH can provide them with, and then make sure they have the flexibility to make the decision they think is most appropriate for their community. And I expect, again, that's going to happen over the course of the next 24 hours or so.
Can you talk about the Boston Marathon, where things stand with that?
There's an ongoing dialogue between the BAA, the city, many of the organizations that support a lot of the runners, and our administration with respect to the marathon. I've said several times that that's a decision that needs to be made, but it's one that I would describe as still a work in progress.
Do you think it needs to be postponed?
Like I said, we've been talking to a lot of people about this, and I fully expect that a decision will be made shortly. And thank you for coughing into your elbow.
Berkshire County, could you speak to the epidemiologists on the ground in Berkshire County and the work that they're doing to track how this has been affecting?
I haven't talked to the epidemiologist, but I did talk to the public health folks who have talked to the epidemiologist. Do you want to speak at all to that question?
Question about what our epidemiologists are doing.
So, as the governor said, we have had 2 Mass Department of Public Health epidemiologists here working with us in the city and county-wide. So they are helping us to establish our systems for contact investigation, communications with providers, the monitoring, and ensuring that we are building our capacity to handle the rise in potential cases that are identified through the increase in testing.
Thank you.
Can I give you one other piece of news that's important because it came up early in our conversation? One of the primary concerns folks at Berkshire Medical had was their ability to staff appropriately, given some of the folks that are currently self-quarantined because of concerns. They haven't tested positive, but concerned that they might. And one of the things we heard from the delegation and from the mayor about was a more aggressive process for nurses and other medical professionals who are licensed and qualified in other states to be able to get licensed and qualified in Massachusetts quickly. You know, one of the examples of how this executive order that we issued earlier this week becomes important is under the terms of that executive order, the Board of Registration in Nursing was able yesterday, under that executive order, to put in place an emergency procedure that will make it possible for licensed out-of-state medical professionals and nurses to get licensed here in Massachusetts in one day, which I think will dramatically help, especially some of the folks who are in the kind of position that Berkshire Medical is in today.
Thanks, everyone. You have taken advantage of that.
Yeah. No, that is one of the things. The Division of Insurance put guidance out to the health insurance carriers earlier this week on this issue, and we expect full compliance on that.
Thanks, everyone. Do you know how many nurses have taken advantage of that?
That literally just happened
Today?
today.
Today. So
Yeah, well, they voted on it yesterday. They voted on it yesterday.
Okay.
But I certainly think it will make it easier for any hospital or any healthcare organization that's looking to deal with staffing issues to be able to get. This process normally takes a lot longer. So,
Thanks, everyone.
Thanks.
The CMT, they just announced that they're not going to have any more jury trials for the next.
Say again?
No more jury trials, no more.
This is who?
New Hampshire.
Okay.
They just announced that. In New Jersey, they talked about having curfews on big celebrations like cars or big gatherings. Have you thought about any of those things here in Massachusetts?
Yep.
Where do they stand?
I know the courts are talking to folks on our team and to others about how they want to manage their caseload and their case flow, and my expectation is you'll probably hear from them sometime shortly, and we'll probably have more to say on large venues shortly too.
Thanks, everyone.
State House should be closed. The Senate leadership is severely cutting back on their activities, their public experience. What's your thought on that?
Well, we certainly believe that we should follow our own rules with respect to large gatherings, and so there are a whole series of large gatherings that were planned to take place in the State House that were sponsored by our administration that we've canceled. And the one that's going to happen most quickly is one that the Lieutenant Governor and I really enjoy, which is, and Western Mass does too, which is Agriculture Day. We canceled that, but there are a whole bunch of organizations like that and events like that at the State House that we're just not going to do because we don't think it's appropriate to bring big groups like that together under these circumstances.
Thank you.
Thanks,
Western
guys.
Mass, they sometimes have access problems with the internet. So if schools close here in other parts of the state, it might be impossible for some students to learn at home. How much of a factor is that in deciding whether or not there should be a statewide closure?
Well, first of all, the guidance that we're going to offer to superintendents and cities and towns is going to be clinically based. I mean, that's really goal number one here, is give them good guidance on what, from a clinical point of view, is the best thing to do and the best decision to make for their communities. The DESE folks already gave them flexibility with respect to how you count days toward the end of the year and some of the other issues associated with that. I think the issue with respect to internet access is one that obviously we are quite familiar with. I mean, we spent tens of millions of dollars and a tremendous amount of time over the course of the past several years creating solutions for the 55 communities that didn't have internet access when we took office. And the good news is that problem's a lot smaller than it was 5 years ago, but there are definitely communities for which that is still an issue. And that's got to be something that gets factored into how they think about this and how they make decisions. But the guidance that we think is most important for communities at this point is to give them the best clinical guidance that the DPH can with respect to how to handle these issues, and then work with them on a case-by-case basis to help make sure that their kids are safe, but at the same time they get educated.
Thanks
folks. I really got to go.